Thank you for listening to me and bearing me and upgrading your consciousness from to this highest level, the Triorigin posture consciousness. And I'm glad that after seeing all my visualization videos, you all have upgraded yourself to because now you are aware. So the thing is, what we have to understand right now is that I'm right now live here, and you all have visualized all my lectures up till now, and that's a great thing because now it becomes easy for me to explain to you what I am doing. So the thing is, now our topic is stack sitting. Stack sitting, one thing I have told you very clearly that one thing is like hidden, like not hidden, means one is healing. Healing means when a patient comes to you and the patient has been suffering from this thing. Patient has been suffering from back pain and you want to heal that patient, then stretch sitting means you stretch the back and now discs are getting hydrated and they're going back, because body has a tendency that if given the right conditions, body has a tendency to heal itself. Like for example, अगर आप if you cut liver half, अगर आप liver को आधा काट दें तो liver will grow on its own. If you don't if the healing condition of, if, like suppose I had the wound, big wound here, and if I was daily doing something on this wound, it was not healing, right? So what happened, doctor told me, you don't know, my surgeon told me, you don't do anything here, it will just heal. And I did not do anything, and within 7 days it healed. Means if you are not troubling that particular area of your body, it will automatically heal. So that is the thing which you have to understand, right? So the thing is, we are right now on stretch sitting, which is a great thing. No, stretch sitting has been told to you. Now we are going to discuss stack sitting. Stack sitting is like when you want to be in a bliss while sitting and you are not hurting your back, because at many times you will not be having a back chair to give your back stretch. Then and at many times you will be sitting on the floor, like jameen pe baithe ho gaye aap, and you may be sitting on a wall. So how you should be sitting there so that you remain in the bliss and your back is healing all the time. So let's see, let's see guys. This is this child who is sitting, look at it. This is called a stack sitting. He is in the total bliss. His back is not in pain and he is sitting so nicely. Straight sitting. Pelvis is anteverted and back is absolutely straight. And tail is seen here. See, the tail is seen here. So the thing is, the pelvis is the foundation for the upper body. With the pelvis well positioned, the upper body can be upright and relaxed. Like in this case, pelvis is so nicely positioned. This is the exact contour which the back should have. With the pelvis poorly positioned, the upper body is either relaxed but slumped like this. This is poorly positioned pelvis. The upper body is either relaxed but slumped, or if even the pelvis is not positioned properly, the upper body may be tense like this. So what you want is, you want to position your bottom little back. Whenever you sit, you keep your bottom little back. That is most important. So you see here, bottom is little back, upright and relaxed posture on a well-positioned pelvis. Anteverted pelvis is anteverted, bottom is little back. Here she is sitting on the bottom. That is wrong. Relaxed but slumped posture on a tucked pelvis. This is upright but tense posture, because again she is sitting on the pelvis, bottom is not back. This is called tucked and retroverted pelvis. Stack sitting is like a stacking building blocks on a sound foundation. Tucking your pelvis compromises your building with the poor foundation. If you tuck your pelvis, like in the position number 2 and 3, this breaks, then your foundation is not good. And stack sitting, when your bottom is back and your pelvis is anteverted, you are on a very strong bottom, so strong foundation. So your bricks of the spine will be very nicely placed. Tucking your pelvis compromises your building with the poor foundation. It will, so the foundation is poor. So to keep these bricks upright, you will need extra support from your muscles of spine to remain upright. Imagine, always, whenever you sit anywhere, always imagine one thing, that actually we were apes. And always imagine you have an extended tail, and place your tail always behind you for a healthy posture, and do not sit on it. Are you getting it, guys? This is always, whenever you are sitting anywhere, if you want to be healthy, just sit like this. Just sit like this, okay? Just sit like this. Always use most of the times I recommend always use a wedge. A wedge may be a towel, a blanket, a pillow. Like for example, when I am sitting right now, I am using a blanket, or not blanket, I'm using pillows, where I'm sitting on a chair and I'm using pillows. And if you see carefully, the pillows are like this, and I am doing an anti-version of my pelvis to be greatly sitting in a very good posture. My shoulders are well aligned, okay? I am very close to my computer. My neck, if you see, is elongated, and I am feeling bliss. This is what I just want to teach to people, to experience physical bliss, so that you people achieve smile fast. You go into the meditative state fast, right? So the thing is, always use a folded fleece, towels or blankets or pillows to make more comfortable wedges. If you are in the habit of tucking your pelvis, if you are in like so, try, means if you are not able to sit properly like this, if you can't sit and you are getting difficulty in sitting like this, then what you do, sit on a towel, maybe pillow, or the front edge of maybe when what you simply do is go near the front of your chair. What will happen? Your pelvis legs will go down like this. Whenever you are sitting back, if this lady, now here actually what has happened, she has again gone into a little anti-version again. And this is okay, but this is not proper. And this chair, maybe she need to go more front. If you go more front, like she did, her legs will again hang down, like slanting of the legs should be there. So sit on a wedge or the front edge of your chair, preferably with one or both thigh slanting downwards. These thighs are also slanting downwards. When your back and pectoral muscles are relaxed and your abdominal muscles have good tone, your resting breathing action will be primarily in the back and the chest. Suppose your back is properly, this pelvis is properly positioned and your abdominal muscles are very, like your inner corset is set. What will happen? These things will not move in the respiration. What will happen? With every inhalation, your spine will elongate and your chest will go, chest will expand. And with your every exhalation, you will be decreasing the length of your spine. With every inhalation, your length of the spine will increase, and this is what actually should happen. The good respiration is not here, it is here. And what is the movement? Movement is this: up and down, up and down, up and down. Why? Because with every inhalation, what happens, if your breathing is correct, you give length to your spine and the hydration of the discs happen. So this is what actually the ideal breathing should be. And this is contrary to the belief of the yoga system that Indian yoga says that you should do abdominal breathing. And see, most of the times what happens is I am always controversy with some ancient healing like Ayurveda. मैं हमेशा उसके अगेंस्ट हूँ कि दूध नहीं पीना चाहिए. अभी योगा के भी मैं थोड़ा सा अगेंस्ट हो गया कि उसके कंट्रेरी की आपकी जो ब्रीदिंग है वो एब्डोमेन से ना होकर चेस्ट से होनी चाहिए और the movement should be like this. So if your abdominal muscles have a good tone and pectoral muscles are relaxed, your inner core set, which I will be teaching you how to set your inner core set, your resting breathing action will be primarily in the back and the chest. But if you are not sitting properly and if your back and chest are tight, back is not relaxed and chest is tight when you're sitting wrongly like this, and or your abdominal muscles are flaccid, means your inner core set is not sit, your resting breathing action will be mainly in the belly. So whenever you are stack sitting properly or you are stretch sitting properly, but you will feel that breathing is not happening in your abdomen, breathing will happen in your chest and back. You can feel like I'm right now sitting, and if you see, with every with all my breathing, my back is elongating and coming down, because if you see, I have my abdominal muscles are very taut because I have set my inner core set, and I am sitting with my bottom back. My bottom is back because I am on a pillow, so my bottom is back, and with every breathing you can feel that my chest is going up, and with every exhalation my chest is going down. But remember one thing here, you should be careful in one thing. The thing is, you should not protrude your chest. Always remember. So first, that is rib anchoring, means your rib should always be anchored like this with an anteverted pelvis. If your pelvis is well anteverted like this, what will happen? The pubic bone will go down here. The pubic bone is positioned to support the pelvic organs properly. And your organs are all sitting on a bone, and bone can hold all the organs. But with the retroverted pelvis, when your pelvis is not proper, the Kegel muscles, the pelvic floor muscles, which I told you is like a hammock, and the pubococcygeal muscles are obliged to assume this role. They have to do that role of keeping all the organs up, and they will become lax, and your rectum or your this may be prolapse. Your rectum may go prolapse, your uterus may prolapse. So the women who don't sit properly, they suffer prolapse of the anus or the rectum. But remember, stack sitting should not be done by those people. If you have any suspicion of any herniated disc, skip stack sitting. First, for 3 months, just only do stretch sitting, and skip this lesson and the next, because this lesson of stack sitting has to be not to be done who have a back pain. Stack sitting should only be done who are healthy to prevent any further damage. But if you are having back problem, do only stretch sitting and stretch lying on the back, and first let your back heal. And after 1 to 2 months, when your back is well healed, you can just do this stack sitting. Because what happens in stack sitting, you are taking your bottom back, and that can cause a little, if you already have a herniated disc, it's not already, that may pinch on your nerves, and you may feel the pain of that herniated disc. Although it may not harm, but I think it may become a little uncomfortable for you. So this lady is sitting very nicely, stack sitting, pelvis is anteverted, legs are hanging down. This man is sitting on his tail wrong. This boy is also sitting on his tail, which is totally wrong. So this is the ideal anteverted pelvis. This is tucked pelvis. This is severely tucked pelvis, totally wrong. And this is overly tipped pelvis. Bottom should be little out. This is too much of bottom out, and there is lordosis at upper back, and this will also cause pain in the back. This is overlie tipped pelvis. Okay. This is ideal back. This is ideal back. This is the ideal back. Just one phone call, people. So the thing is, what I am here teaching is, the thing is that this is the ideal straight back. This is rounded or kyphotic low back, which is wrong. And this is swayed back, which is lordotic back. Both these two are bad, and this is good. This is normal, nice back. This is rounded kyphotic back, wrong. So ideally what happens if your back is very proper, you will have a small groove in your back, little halka sa gadda hoga. Agar if you are able to feel the spinous processes which are little protruding out of your back, that is wrong. This is wrong. And too much of depression, too much of groove in the back is also wrong. Your back should always be like this, little groove. And always try to feel your back, how you are sitting, always. This is again a very nice posture of stack sitting. This is again very nice, wonderful stack sitting. This is again wonderful stack sitting, although because of the flexibility of her in the hips, she is bending. This is extraordinary flexibility, but if you even see, this is again stack sitting. This is again stack sitting. This man is also doing a wonderful stack sitting, right? So the thing is, but remember, whenever you are doing breathing in the chest, what will happen is you will have a tendency, you will always have a tendency to pop your chest out, which is wrong. You should never pop your chest out. You should always keep a rib anchor. Rib anchor, I have already told you that you have a power button here, which you press like this, and you, this area, always, yeah, this is the power button. If you press this button and take this button, the Xiphi sternum, to here. Here there is a hook. Imagine there is a hook here. There is a hook here, and you place this button on this hook here. So what will happen is your back will lengthen. So that is very important, very, very important. A healthy way to flatten the low back is this rib anchor. This I will be teaching you in my practical lecture. After lengthening your neck properly, you will need to use your eye muscles to direct your eyes in a different way. So I have already told you in my those seminars that your eyes see little downwards. They never see straight. This is straight seeing, and this is little downward seeing. Right? So this is lengthened neck. You see, this is more length than this. Here, both are equal. This is shortened, and this is lengthened. Both are equal. This is wrong. So if the chair is too high, a chair that is too high may result in an unhealthy seated posture. So what you do, you go in front. You go it little front, and with the problematic chair, sitting on the front edge can help. So this is all wrong sitting. This is wrong chair. These are all wrong chair. This is wrong sitting. This is wrong sitting. This is again in yoga, what they teach is wrong, because here you see she is sitting on her tailbone, and this lady also has taken too much back here, too much of the back, and she's in tense posture right now. So tucking the pelvis and the rounding the low back when sitting on the floor is wrong. Tucking the pelvis and rounding the low back. This little back has now rounded. And this is too much of tense posture. swaying the back when sitting upright on the floor. And all of us usually meditate in this posture. This is wrong. Her chest is popping out. This is wrong. Rib is not anchored, back is shortened. Sitting cross-legged on the floor unaided without a wedge is problematic for most people in modern industrialized societies, right? So the way we sit traditionally in the yoga is totally wrong. So using up prop facilities of stack sitting on the floor, like you can use a pillow, blanket, or this wooden stool. And sitting in the Japanese Seiza position facilitates stack sitting, but frequently requires healthy knees. This is very good Japanese way of sitting. Like हमारा जो आसन होता है जिसमें कि आप use करते हैं उसे, तो that is a very good way of using this thing. This is a very good way of using this thing. This is a very good way of using this thing. Sitting in the Japanese Seiza position facilitates stack sitting but requires healthy knees. Using the arms to lengthen the spine. Using the arm, sometimes you can sit this like this also. Because here you have again used arm to lengthen the back. This is very good. To lengthen the spine facilities sitting on the floor. These are some healthy options for sitting on the floor. So this I have told you. This also I have told you. This also I have told you. And this is the wonderful position. So guys, thing is, this is very clear, and thank you very much. This is the best thing which you can enjoy. Like me, I am sitting like in a stack sitting position. So now practical of stack sitting will appear next. Thank you.